All right, so we'll quickly try to look at the COPD. So, COPD is what is known as the chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. Okay, COPD. So, this is COPD, and you could see that it has to do with fluid is filling up your alveoli. Okay, fluid is filling up your alveoli. So your alveoli should normally be what? Head up like this so that you're able to breathe well. You understand? But if you have issues in your alveoli like that, that's fluid in your alveoli to block how you are breathing very well. So it's a progressive lung condition. When they say progressive, it doesn't just start all of a sudden. It's moving gradually. You know, so it makes it hard to breathe due to long-term damage, okay, to the airways and alveoli. So it's most often caused by smoking, but also environmental exposures and genetic factors can also play a role. So nature is chronic, is progressive. The damage that will be caused will be irreversible. So we have different types. We have the chronic bronchitis, we have the emphysema. Okay, we have the causes is generally smoke, okay, also air pollution and occupational dust and chemicals. I can relate to this because I'm just coming from occupational health in um, community medicine, okay, and also sometimes there's alpha 1 antitrypsin, deficiencies. So this is COPD. So symptoms is you cough a lot and it has mucus, and you are not breathing well, especially during activity. You are wheezing and there's chest tightness, you know. Then you easily get infected with respiratory infections. You are weak and there's weight loss in advanced stages. So complication, it could lead to pulmonary hypertension where the blood pressure in your lungs is high. It could lead to right-sided heart failure, that's called pulmonary. Then frequent exacerbations where you're having flare-ups, and there's increased risks of lung cancer. Okay. So diagnosis, use all the spirometry where you're trying to tell somebody to blow inside something. So you're trying to look at how this person is able to still maintain their breathing with this condition. Chest x-rays, that's why I'll do all those, all those CT scan. So that I'll look at the lungs and look at the various damages in the lungs anatomy. Then blood tests where I'm trying to see if there's a deficiency of the alpha 1 antitrypsin. Okay, so clinical history too. I'll ask the patient some questions and I'll try to drive it through. Or do you party? So when you party, do you smoke? You know. So management first thing is if the person smoke, they have to stop it completely. Not that you should be smoking small. Stop it. Then medications like what? Bronchodilators to relax the airways, inhaled corticosteroids to deal with the inflammation, oxygen therapy if the person is finding it difficult to breathe, the pulmonary rehabilitation where they have to do exercise, nutrition, and education programs.